Neck curves and spinal curves don't matter when it relates to pain. That's just an uneducated response. Look, this is what was said on social media, and tons of things are said on social media that's not true. But when you have a healthcare provider that is saying that and ignoring the science and evidence, I think that's a threat to public health. They have the right to help you with your back pain, but when they say that a certain spinal pathology has zero relation to pain, when in fact there's ICD-10 codes because of a cervical kyphosis is related to pain and decreased quality of life, there's other diagnosis aspects, and then just look at scoliosis. You're going to say people with scoliosis and abnormal spine curves, that their pain is not related to that. If that's true, sue every single orthopedic surgeon and spinal surgeon on the planet that's ever straightened the scoliotic curvature due to pain. But let's take a look at why this is incorrect. Now, my opinion on this is this person is saying this because they sell home programs for you and your back pain. My guess is he's getting a lot of questions from people saying, can you help me as I've been diagnosed with an abnormal spinal curve? And they have nothing to sell you, unfortunately, for you to do at home. There's no exercise that's going to fix the curvature. There's only been two things that have been proven to restore the normal spinal curve. Surgery, if they fuse it into a lordosis, and chiropractic biophysics, a type of technique that's been proven in lots of peer-reviewed research to restore the normal lordosis. But let's just get into, is there any evidence that spinal curves are or are not related to neck pain or to pain? Because this particular person says there isn't. So let's take a look. Let's start with the journal Spine, starting in 2004, titled Modeling of the Sagittal Cervical Spine as a Method to Discriminate Hypolordosis Less Than a Normal Curve, the results of an elliptical and circular modeling in 72 asymptomatic subjects, 52 acute neck pain, and 70 chronic neck pain. This is from Harrison et al. What they found is that the pain groups had a worse spinal curvature than the patients with no neck pain that had a normal curvature. Let's take a look at the book, Clinical Biomechanics of the Spine. I believe this was Anna Yale from White and Punjabi. One of the radiographic signs of spinal trauma is a loss of the lordosis or an acute kyphotic angulation. These are abnormal curvatures that are associated with trauma and pain. Let's take a look at this paper here titled Straightened Cervical Lordosis Causes Stress Concentration. What they found was that a flat neck, not even a reverse neck, increased the pressure on the discs, the facet joints, up to 95%, and that even pulled on the spinal cord, hindbrain, and cranial nerve roots. All of those related to pain. How about the Journal of Neurosurgery, published in 2001, titled The Effects of Cervical Spine Posture on Axial Load-Bearing Ability. This was from the Biomechanical Study Department of Neurosurgery. What they found is that the cervical spine has a natural lordotic posture. Additionally, the upper cervical spine and craniovertebral junction provide the majority of flexibility. These two characteristics of the cervical spine play a major role in spinal biomechanics and the predisposition to cervical spine injury, meaning when you lose that cervical curve, it's more likely to be injured and leading to more pain. How about Journal of Neurosurgery, titled Global Sagittal Access, a Step Toward Full Body Assessment of Sagittal Plane Deformity? What they found is that sagittal malalignment or abnormal spinal curves require higher energy expenditure to maintain an erect posture. And the radiographic analysis of sagittal plane is a critical part of the clinical evaluation and surgical care of spine patients because it's correlated to pain. How about Journal of Neurosurgery 2016? What they found is that worsening of the cervical sagittal parameters is associated with decreased health-related quality of life, and a kyphosis, meaning an abnormal curve, which this TikToker says has no relation to pain, is the most common cervical spine deformity encountered, and its correction results in improved clinical outcomes. The way that they fixed this neck is they fused it into a normal curvature. If you go to the appropriate chiropractor that actually is certified to restore the curve, this can be done because we know abnormal spinal curves are related to pain. How about this paper here, where they looked at Journal of Orthopedic Surgery in 2023? What they found is that cervical deformity, i.e. abnormal spinal curve, especially a kyphosis, has been associated with myelopathy even without canal stenosis. This phenomenon is a result of the kyphosis leading to the spinal cord being draped against the vertebral bodies. The draping causes anterior spinal cord pathology from compression against the vertebral body. In addition, it causes an increase in the longitudinal cord tension due to the cord being tethered by the dentate ligaments and cervical nerve roots. And tethering of the cervical cord can produce increased intramedullary pressure, leading to neuronal loss and cord demyelination. I also published a paper in the Journal of Brain Circulation that an abnormal cervical curve decreases blood flow to the brain. So for anyone that is listening to a provider that says to you that spinal curves do not matter, I would say run. The evidence is too strong. And if what this person is saying, that spinal curves don't matter to pain, then if you're a lawyer listening to this, you should sue every spinal surgeon that's ever fused the neck into a proper lordosis or to try to reduce kyphosis, because it is a standard practice and standard knowledge that abnormal spinal curves are a problem. Like I said earlier, or should we just completely disregard all the evidence diagnosis codes, scoliosis and kyphosis, as it makes no difference? So look, be careful who you listen to. Be careful who you listen to with me. I just produced a couple of research articles that are linked to it where this one person said there is no correlation. That was pretty easy to find. So they either ignored the evidence, didn't look for the evidence, or are aware of the evidence and lied. Anyway, have a great day.